The spread of COVID-19 has presented unique challenges to everyone across the country. One new challenge has been addressing mental health concerns as people deal with new anxieties and depressions that arise from everything: social distancing, the growth of COVID-19 cases. While most people are experiencing more stress and anxiety than usual, Canada's essential workers have to face increased stress and anxiety while still performing on the front lines. So I think a number of people who are working, dealing with stress, are now wondering what disability benefits are available to help them deal with their issues, their health issues. So let's talk about that with Nainesh Kotak, founder of Kotak Personal Injury Law. Hi, Nainesh. Welcome back to the show.
Thank you, Barb. It's a pleasure to be on.
You know, it's interesting. Until we sort of looked into having you on the show to talk about this, you really only talk in terms of CERB and EI and those kinds of benefits without realizing there are other disability benefits that people may be entitled to because of COVID-19.
Exactly, Barb. In fact, there are short-term disability plans that, in fact, would be available to many essential workers through whether it be healthcare or fire or police, that they could actually apply to. And the condition would be this: is what is stopping them from working or being unable to work due to whether it be mental illness or stress. Is it the actual condition, or is it the availability of work? If it's availability of work, that becomes difficult to establish a case. But if in fact it is the increased depression, post-traumatic stress disorder, obsessive compulsive disorder that could occur in a pandemic situation, if that is the reason they're unable to continue their work, whether they're an essential worker or not, there's a very valid claim, in fact, to apply for short-term disability benefits. And I think nowadays insurance companies should would look at this with a much kinder eye than perhaps normal, given the fact that we're all in this together. The fact is, Barb, 1 out of 10 COVID patients or people with COVID-19 in Ontario are a healthcare worker. So the stresses they're dealing with, the stresses our grocery store clerks are dealing with, police, fire, ambulance, what they're dealing with is not only their own safety. They're dealing with the general public and often a sick public, but they have to worry about their own families at home, elderly, their children, their spouses, and if they become infected, are they going to pass that on? And this stress, there are support mechanisms available, whether it be EAPs, employment assistance programs, whether it be CAM-H or telehealth. But we have to look at not just the emotional and psychological aspect of treatment, but we have to look at the financial aspect. That many people are going to become debilitated in terms of their ability to work because there's overwhelming anxiety. And there are resources available. You have the government plans, but there are these private group plans that many workers have that they should, in fact, exercise that and apply if they qualify under the policy.
Nainesh, I feel like there are a number of people out there working, not recognizing that, their fear of going into work could be seen as a disability. And I wonder if some people end up risking being fired because they're refusing to go in, while they should be looking into, perhaps, as you said, short-term disability.
Well, there are a couple of things. One, let's say they're looking at, a general fear, is my work condition safe? Well, then there's occupational health legislation that they could deal with and ask the employer to challenge, is this safe or not? But if we go beyond that, if we go deeper, and it really develops into an anxiety, that dread, that panic, the heart beating so hard, you're immobile, you really can't function and do the job, that's when they should be thinking, look, this is what you need to do, is apply for your disability plan because it's available to you. And, Barb, we're going to be, even when this pandemic is over, and, we're all praying for that, and one day it will pass. Mm-hmm. There's going to be post-traumatic stress disorder for many people on the front line who've had to see people sick, see people dying, and see other people in traumatic situations, and they now have to internalize it themselves. And I think if you're in that situation, down the road, you would need help as well, whether it be from treatment, but also financial help through applying through your disability plan as well. The effect of this pandemic on people's psychological well-being is going to be long-term. And I think we have to come to terms with this.
I think that certain people who are working on the front line, well, certain people are feeling definitely the stress of being put in terms of the way they're looking at it into harm's way. But then you've got people who are working in health facilities who might be seeing things that they're just going about their job because it's what they have to do. But then when all the dust settles and we're on the other side of it, I guess that's when it can really hit people. And as you say, that's the classic PTSD.
I think you're absolutely right. You know, there were stats actually from China where this all began. Healthcare workers, they said over 50% reported symptoms of depression, 44% symptoms of anxiety, 34% insomnia, and 71% stress. They were dealing with watching out for their own safety, but also seeing patients die. And these stats are being repeated again in New York, Italy, and will be here as well. And that's just something that we have to recognize as a society, that our healthcare workers, we say they're our heroes, but in reality, they are, and they need support, whether it be from treatment later on, or whether it's going to be financial help if they're unable to continue, in fact, with their essential work.
Sure. They're heroes, but they're still human.
Exactly.
Right. So if somebody is thinking about making a claim for disability benefits as a result of this pandemic, are there some things they need to do? What steps should they take?
Right. So it's there's three basic forms that are going to need to be filled out. One is an employer statement, which is just factual. It really sets out the last day of work, how long they've worked there. The second is the employee statement, and that is filling out their own subjective personal condition. What is stopping them from working? What has happened? And the third, and probably the most important, is the physician certificate. That's going to set out the diagnosis and the functional limitations. And, this time, a lot of doctors are not seeing patients face-to-face. They're doing it by telephone, etc. So this could be done online, speaking to the doctor over the phone. And please fill out these forms. And I think you'll have a fair understanding from physicians who are probably going through a lot of stress themselves. So that is the actual process of the application for disability benefits. And you can get the forms through your HR online through the respective insurance company who you're insured with.
What has this time been like for you in personal injury law?
Our practice is primarily the disability law, so I'm telling you, it's been quite busy. We're working remote. Today I had a mediation from home. We're using Zoom, WebEx, and other digital platforms to meet with existing clients and new clients. We're getting a lot of calls, actually, of people who are just having a very hard time coping and unable to work, even though it's something that's expected of them. So we are quite busy, and we're really hearing the emotional stories from people who are suffering.
And it's a great point, too, that when this does come to an end, that doesn't mean this part of it comes to an end, because a lot of this will sink in for people once things sort of start getting back to normal or things get lifted.
I agree, Barb. It's like every second generation goes through some sort of existential crisis that the next may not have to go through. And maybe our previous one was World War II. And this is not a war per se where there's bombings, but it's a war in the sense that, we are the weapons, and it's very difficult to console each other because we can't have that type of contact. So it's something that's really going to affect everybody in our society, I think, for the rest of our lives in terms of memories and in terms of emotions.
It's great to talk to you. Nainesh Kotak, thank you very much for this.
You're very welcome. Thank you.
He is the founder of Kotak Personal Injury